Assalamu alaikum. Today I will discuss on Cushing reflex. So all of us know that this Cushing reflex is a physiological reflex which protect our brain during increased intracranial pressure. So if due to any cause your intracranial pressure is increased, so we know that at that moment our brain gets little amount of blood. Okay, so this Cushing reflex try to increase the blood flow towards the brain to protect the brain from being damaged. Okay, so to before discussing today's topics, I want to briefly discuss about this intracranial pressure. So our brain, suppose here the rate rounded portion is your brain, and the pressure within brain is indicated as intracranial pressure, that means ICP. And in the other hand, the total average pressure in your systemic circulation is indicated here as mean arterial pressure, and we know that the mean arterial pressure is equal to diastolic blood pressure plus 1/3 of pulse pressure. So what about that? So we know that the mean arterial pressure is more than the intracranial pressure. So we know that the blood flows by its nature from high pressure to low pressure. So Almighty has created this in such a manner that the mean arterial pressure is more and the intracranial pressure is less. So blood flows from the your body, that means from the heart to the brain. Okay, so this blood flow towards the brain is known as cerebral blood flow, and the pressure difference between the mean arterial pressure and intracranial pressure is known as cerebral perfusion pressure. So the cerebral perfusion pressure maintains the cerebral blood flow. Okay, so remember, that means the cerebral perfusion is professionally related to the cerebral blood flow. That means the more the cerebral perfusion, the more the cerebral blood flow. So when will the cerebral perfusion more? When the difference between mean arterial pressure and intracranial pressure more. Okay, so this is all about that. So during increased intracranial pressure, here you can see the intracranial pressure is increased. That means this portion, the pressure is increased in this portion. So I want to explain it by some numerical explanation. Suppose the intracranial pressure is 50 normally and the mean arterial pressure is 100. So what will be the cerebral perfusion pressure? 100 minus 50 is equal to 50. Now, if due to any cause the intracranial pressure is increased, that means it increased from 50 to 80 millimeter of mercury. So what will be the cerebral perfusion pressure now? Yes, this will be 100 minus 80. That means now the cerebral perfusion pressure is 20. So you can see here that if the intracranial pressure increases, cerebral perfusion pressure decreases. Okay, yes, that's it. So whenever the cerebral perfusion pressure decreases due to the increment of intracranial pressure, so I have already mentioned you that the cerebral perfusion pressure is proportional to cerebral blood flow. As there is decreased cerebral perfusion pressure, so there will be decreased cerebral blood flow. So our body will physiologically try to compensate this by increasing the mean arterial pressure. Okay, remember it, the cerebral perfusion pressure is decreased due to the increment of intracranial pressure. So our body will try to increase the mean arterial pressure to increase the cerebral perfusion pressure. Yes, so what will be happened to increase this mean arterial pressure? Yes, to activate the sympathetic nervous system. Actually these things will be happen there. So again, intracranial pressure is increased, so cerebral perfusion pressure is decreased. I have explained it. And as the cerebral perfusion pressure is decreased, so cerebral blood flow will be decreased. That means our brain is getting little amount of blood. So our so whenever the brain will get little amount of blood, so what will happen? The central chemoreceptor located on our brain, they will be activated. Yes, they are able to detect that the brain is getting less amount of blood. Okay, so the central chemoreceptor will detect this abnormality and they will send signal to the vasomotor center. The vasomotor center, please take an urgent attempt to help the brain from being damaged. Vasomotor central will assure the central chemoreceptor, okay, don't be anxious, I will try to take an attempt to compensate it. Okay, then the vasomotor center will increases the sympathetic outflow. So what will happen if the sympathetic outflow is increased? Yes, we know that sympathetic nervous system has the effect on both the blood vessels and heart. So the sympathetic nervous system will do vasoconstriction through acting on alpha 1 receptors, and it will increase the force of contraction through acting on beta 1 receptor on your cardiac muscles. Okay, so that means we have shown you that due to the activation of sympathetic nervous system, there is happening two things. One is vasoconstriction, which will increase the diastolic blood pressure, and another one is increasing the force of contraction, which will increase the systolic blood pressure. Because in one of my previous lectures I have told you that the diastolic blood pressure is professionally related to vasoconstriction. That means the more the vasoconstriction, the more increment of diastolic blood pressure. And the force of contraction, that means cardiac output, is professionally related to systolic blood pressure. That means the more the cardiac output, the more increment of systolic blood pressure will be. Okay, so due to this two effect, your mean arterial blood pressure will be increased. Yes, I have told you just before that our body will increase the mean arterial pressure to increase the cerebral perfusion pressure, to increase the cerebral blood flow. So you have shown that how does it happen. Okay, now the interesting thing will happen. So our vasomotor center increased the mean arterial pressure to increase the blood flow towards the brain, but due to this increment of mean arterial pressure, our baroreceptor will be activated. You know that the baroreceptor, high pressure baroreceptor, is located on two sides. One is in the root of the internal carotid artery, that means the bifurcation between internal carotid and external carotid artery. Here are the carotid baroreceptor, and another baroreceptor are located on aortic arch. So when the mean arterial pressure is increased, this baroreceptor become activated. This baroreceptor will think that why the mean arterial pressure increased. So this baroreceptor will send signals towards the vasomotor center. Vasomotor center, I perceived that the mean arterial pressure increased. Please take some attempt to decrease this mean arterial pressure. Think about that. The baroreceptor is sending signals to vasomotor center to decrease the mean arterial pressure. In the other hand, the central chemoreceptors sending signals towards the vasomotor center to increase the mean arterial pressure. So actually I want to write this to make you understand easily. That is, there is happening two things. One is central chemoreceptor, which sending signals to vasomotor center to increase the mean arterial pressure. But on the other hand, the baroreceptor sending signals to vasomotor center to decrease mean arterial pressure. So the vasomotor center is getting dilemmas that what will I do? One is calling me to increase the blood pressure, mean arterial pressure. Another one is requesting me to decrease the mean arterial pressure. So what should I do? So vasomotor center will try to make happy both of them. So the vasomotor center will start to increase both the sympathetic and parasympathetic impulse. Okay, yes, exactly. So now the parasympathetic stimulation will be increased, and we know that the parasympathetic nervous system mainly supplies the S node of your heart, and the parasympathetic stimulation inhibits our heart. So due to overactivity of parasympathetic nervous system on S node, your S node becomes suppressed, so heart rate will be decreased, so there will be bradycardia. But on the other hand, the overactivity of sympathetic nervous system on your heart, that is increasing your force of contraction, so there will be increased systolic pressure. Yes, so in case of Cushing reflex, due to simultaneous activation of sympathetic and parasympathetic nervous system, there will be three things. One thing is increased systolic blood pressure, another one is decreased heart rate, that means bradycardia, and another one is due to this simultaneous activation there will be the irregular breathing. Okay, so these three things are known as Cushing Triad. One is hypertension, especially systolic hypertension. Diastolic BP will be less, and as the systolic BP is more, diastolic BP is less, so pulse pressure will be wide. And another one is bradycardia, and another one is irregular breathing. These three are collectively known as Cushing Triad. Okay, so as the parasympathetic stimulation is increased, there will be happen an interesting things, and this is Cushing ulcer. Why? Because the parasympathetic nervous system will activate more and more the gastric parietal cells, okay, through muscarinic 1 receptors and muscarinic 3 receptors. I have discussed it one of my pharmacology lectures. So the gastric parietal cell is now stimulated more and more, so they will start to release more hydrochloric acid. So this increased secretion of hydrochloric acid will lead to the ulceration, that is known as Cushing ulcer. So a patient of having raised intracranial pressure due to any cause may develop the Cushing ulcer. So I have tried to explain this complex matter as easiest way. So if you like my lectures, then please be connected and keep me in your prayer. Allah Hafiz. Assalamu alaikum.